Hello. How's everyone doing this evening? How's everyone doing this evening? Fantastic. Well, I really appreciate everyone who joined us this evening. We have a topic that we will be discussing that is extraordinarily important, not just for ourselves, but for our families, our extended community, and for those that aren't even aware fully. Because the thing about mental health is sometimes it's hidden, sometimes it's disguised, sometimes there are stigmas. And these are all things that we're trying to break. We're trying to push through. And it takes one step at a time for us to get there. And it takes all of us to participate in that process so that we can be knowledgeable, aware, and bring about all the resources necessary to those that we touch on every single opportunity that we have each and every day. So with that, I'm really just here to kick off the event, say welcome, tell you this is very, very important. Tell you to listen very closely to the discussion that will ensue with the panel. We have an exceptional panel. They're all going to have their own personal experiences as well to share. And certainly we will also be having some Q&A. So get your questions ready. I want everyone to walk away from this event knowing something they did not know before, with a resource that they can offer to someone else or that they can take advantage of for themselves. So with that, let the discussion begin. Irene, come up. Or Louisa? Okay. Louisa, come up.
Good evening. My name is Louisa Wakeman, and I am Commissioner Richardson's cabinet member on mental health and public health. And I am so grateful that all of you are here to discuss this important topic on youth mental health. I'm excited to introduce Irene Barton, who's put a lot of work into making this event successful. And Irene is the executive director of the Cobb Collaborative and has been involved in our community for a long time. She's the previous district director for the PTA of Georgia and is currently the chair for mental health on the PTA of Georgia. I'm pleased to welcome Irene Barton.
Good evening, Cobb County, and welcome to what I think is our first ever mental health town hall. And this one, we're going to be focused on our youth. For those of you in attendance, there's a program in your seats, and we invite you to become familiar with our distinguished panelist biographies, professional biographies, so we could spend as much time as possible on questions and connecting with resources. We're not going to read all of those, but each panelist will introduce him or herself. And for those who are watching virtually, you will be able to connect the phase with the organization. So panelists, are we ready to get started? All right. So going to ask each of you to introduce yourself and your organization, and in a minute, talk about what your organization or the agency that you represent does, and then spend a couple of more minutes talking about just kind of painting this space, since unfortunately this is the space that we are in, that's fine too. So we'll start with Belisa from Sur Familia.
Yes. Good evening, everybody. My name is Belisa Urbina. I am co-founder and executive director for Ser Familia. It is a nonprofit that serves Latino families. We provide family, social, and mental health services to Latinos. Here in Cobb County, we have two offices, one in Kennesaw and the other one in Smyrna. Pre-pandemic, we were already seeing very scary numbers. It's the only word I can use to describe it, with our Latino youth. In Georgia, almost 2/3 of all Latino youth present symptoms of anxiety and depression. And 20% of our Latina girls are going to attempt suicide at some point in their lives. Those statistics are higher than almost anybody in the United States. Sometimes our teens feel very isolated, many times because most of our youth, Latino youth, are second generation. They are the first one in their families that speak the language, that might be documented, and they feel the burden of just being in charge of their families as opposed to being raised by a set of parents. Then the pandemic only has exacerbated these issues. What we have seen is that kids feel very left behind educationally. National statistics are telling us that Latino kids are going to lose more education time than almost any other child from any other race or ethnicity. It's about a whole year of education. So now they feel very behind in their schooling. They feel like they don't have anybody to support them, and they feel they see their families struggling. About 2/3 of the Latino clients that Ser Familias serves have lost at least one source of income in the house. And during the pandemic, more than half of our families, didn't have food insecurity, didn't have enough food to eat. So now these kids that feel so responsible for their families and feel so behind in schooling, what we imagine that is going to happen is that they're just going to leave school. Sadly, what we are predicting is that we're going to lose hundreds or thousands of Latino kids from our school rosters because they feel like they have to provide for their families. Yet another layer that we have seen during the pandemic is that as families were about to lose their homes, they could not afford rent anymore, we had more and more families moving together. So this overcrowding of homes is creating a 231% increase in cases of child sexual abuse that have been referred to us. That is absolutely a number that we never saw coming, that we don't have resources to just tackle. And the problem is that there's an enormous disparity between the number of, Latino in our community. When Ser Familia started 21 years ago, almost, there was about 7% of Latinos. By 2040, 1 in 4 people in Cobb County would be Latino. And there's not enough resources to serve this community. So, we imagine that problems are going to sadly continue to exacerbate and become more complex.
Wow. Belisa, thank you for painting a picture. It's not a pretty one, and definitely speaks to why these conversations are so important and why we all need to work together. So thank you. Meg?
Good evening, everyone. My name is Meg Craner. I'm with Cobb County Community Services Board. I specifically serve as the System of Care Program Coordinator, and the System of Care is a new program to Cobb. Just about a year that we've had this dedicated program here. However, it is a statewide initiative through DBHDD, and so a variety of other counties in the state have had this program as well. Specifically with Cobb, we provide mental health services, disability services, substance use services, individual, family, group counseling for adolescents, teens, adults. And so we have an expansive amount of services, whether that's online, in person, or whatever meets the needs of the clients. As the System of Care Program Coordinator, I work specifically with our ages 9 through 26. Now, that's a huge group. So most of mine are teens that I see, but I work to help them through that transition of adolescence to that teenage years to young adulthood, and making sure that by the time they hit 18, we're not hitting that scary roadblock of I'm an adult now and who's my providers? Can my parents still come with me? All these things, whereas youth, they receive a lot of support and a lot of network that kind of comes around that youth to help them with these services. And then once we get to 18, there tends to be a drop or a lot of confusion that occurs. And so something I've been very passionate about helping and supporting is using my program to transition those youth into adult services. Specifically when it comes to the topic of COVID that we're discussing and still experiencing, there is a high amount of that isolation and a loss, and still this grief of these young kids and youth and teens who are missing big milestones that everybody else has experienced, that their parents got to experience, that their older siblings got to experience, like proms and graduations and maybe getting driver's licenses and all those things. And so that's a big part of my program as well, is pairing with the therapeutic services that they receive. So they may receive one-on-one counseling with a therapist at our facility in-person school from this year of online has been a big stressor for a lot of the clients that we see. There's an increase in bullying and a decrease in social skills because of the response, that was required for the pandemic. And so really that integration or reintegration has been a big thing that we've seen with our clients.
Thank you, Meg. Dr. Lance?
Hi, everyone. My name is Julie Lance, and I am a school social worker with Cobb County Schools. Is that a little bit better? Okay. I'm the school social worker with Cobb County Schools, and I would just like to say in what you had just mentioned, I had a 2020 senior, so all of those milestones that just got cut off, it really hit home in our house, so I got to see all of these struggles firsthand. So that was a very personal thing in our family as well. I want to let everyone know that in case you didn't know, every single school in Cobb County, within the Cobb County School District, has a social worker attached to it. I wish I could say I have just one school, but I have 4, and that's just fine because I love all of my schools. Another thing with the social workers in the schools is that they're clinically licensed, so we're trained in mental health, or we're working towards our licensure. So depending on the school that we are at, the needs are different. What is happening in East Cobb might be a little bit different than South Cobb or West Cobb. So each social worker is really trying to tap into what the needs are for their specific school and work with teachers and administrators to make sure that we're addressing what needs to be addressed. And that can be anything from just providing basic resources for our families, to giving teachers support, to doing individual counseling with children, doing group counseling, going into classrooms. So really we're trying to be a really big wraparound service and make sure that we are available and that our families know that we're there to help them. I think one of the biggest things that I have seen is that there are no more rules, and that has been really difficult, I think, for all of us on the provider side, is that we used to know what the rules were, what would be coming to us, how to kind of work through some of those issues. And with this pandemic, while you still may see anxiety, or you still may see depression, or you still may see anger, it manifests very differently. So we're trying to figure out, how do we address this, because we can't address it the same way. So we're really trying to figure out what's going on at home and how is that affecting the kids that are coming into school and how they're relating with their peers and how they're learning. Education has been an issue for a lot of kids because there's been so much disruption in that, so much catch up, and they want to learn. I will say that all of the kids want to learn, they want to be there. And I will say that all of our teachers want to be there and they want to teach. So it's just trying to find our footing again.
Thank you. Thank you, Julie. And from our other school system, we have Granville.
Good evening, everybody. Can you hear me? Is this one? Okay, we'll just switch. All right, good evening. My name is Granville Freeman, and I am with Marietta City Schools. My role at Marietta City Schools is prevention and intervention strategist. So just within that title, my goal is to strategize on how to make sure our schools, our students, and our families have the resources necessary to be able to participate academically and be successful in whatever means we need to take care of. What I saw before the pandemic is, children being children, families being families, having different life situations that happen, trying to figure out how to navigate those life situations, and finding the support network that you individually have as an individual or an individual family, and just kind of guiding through that. What I saw after the pandemic is what Meg said earlier, is we had a collective sense of grief. And that collective sense of grief was multiple people globally were trying to understand, how do I deal with loss? And loss was not necessarily a death, but it could be. Loss could have been a mental. Prepare yourself mentally for the different roles you take every day, meaning getting up, getting into the car, driving to work, and being able to de-escalate, saying, okay, I got mom hat off. I can go ahead and prepare for work me. All of that was combined in one house. If nothing else, for just a few weeks, but it was combined in one house. And so you had all those 5 stages of grief that you probably saw happening in your home. And I think that we're seeing that as we're opening up the schools, is you're seeing anger, you're seeing signs of depression, you're seeing the bargaining that some of the kids are doing, you're seeing the isolation or the denial. So you're seeing all those areas. And I think that's kind of the biggest area that we're looking at, is trying to navigate it. Just like Dr. Lance said, we knew the rules before this happened. And now everything has become blurred. And what has become blurred is, for the clinicians up here, we knew about differential diagnoses. So it looks like this. So let's see if we can rule out this. Now all of them feel merged. You know, all of them feel like these same symptoms are depression. These same symptoms are something else. And the reality is, we're just trying to work with where you are today. Because today is something that some of our kids didn't feel like we're coming. And not in terms of something happening, but our kids are immediate. Like they need to see the right now. And for a lot of the kids that I talked with during the beginning stages, it was a lot of, well, I'll never have my graduation. And this is coming from a freshman. Or why should I even go back? They're never going to open back up. So that's kind of what we saw. We saw that area of trying to figure it out for them so that we could prepare ourselves to help them through it.
So another loss of hope, it sounds like.
Exactly.
Yeah. So, Belisa, I'd like to come back to the stat that you shared about the 230% increase. I find, frankly, overwhelming, staggering. What can we all do, educators, community partners, to help families with that? Do we all need to take a mandated reporting class? Do we need to make sure that we can all recognize the signs? How can we all help in that?
I think that probably the first step would be for people to recognize the signs. You know, how do I, sometimes people think, you know, this will never happen in my family. This will never happen to me. And sadly, kids are mainly abused by people they know. You know, we always teach kids about stranger danger. And yes, it is important that we teach them that. But normally they are not going to be abused by a stranger. They're going to be abused by somebody that is close to them. So that's why the correlation between families and friends moving into one house, and now the child, instead of having access to 3 adults or 3 adults having access to a child, now it's 10 adults, 9 adults have access to that child. So it's not that people are worse people, it's just that it's a numbers game. It's as sad as that. So I guess that understanding that this could happen to me, that this could happen to my family, this could happen to my friends, that allows you to be vigilant, you know, and you don't need to be scared necessarily, but just vigilant. Just keep your eyes open. You know, just find the signs. You know, what are the signs when a child, you know, gets very withdrawn, or the child starts speaking about topics that doesn't, you know, correlate to their age. Things that you find strange, just, you know, be vigilant, know the signs. if you're going to go get educated on the topic, which anybody that has a child in their lives should get educated about this, take somebody with you. Just get a friend, another family member. Let's just go learn. And sometimes, especially some people that get like very, agitated or offended if you bring the topic. You don't need to necessarily say, I'm protecting our family. No, let's just go because we need to protect all the children that are around us. And I guess that also the more coordinated, and one thing that I guess that Cobb County did right during the pandemic was the coordination among agencies. Yeah. There was a lot of help. Sorts of calls of this group, other group, and there was a lot of support. So it is a good time now to apply the same idea of how we can coordinate services, how we can coordinate resources to tackle this crisis that is brewing. We are seeing it now in the Latino community and the families we serve, but I'm sure it's not unique to us because it's not only the Latino families that are moving together and this is happening. So I think that, that constant support partnership that we found, especially during the pandemic, I think that needs to continue so that we can tackle this next crisis.
Thank you. Please.
A good training for anybody is Darkness to Light, if anybody has ever heard of that. They're based out of Charleston, South Carolina, and their trainings everywhere. So if you ever see one, and they're usually free of charge, go to one. I have a t-shirt actually that I got from one of the trainings, and all it says is, let's talk about it. And I have to be in the right frame of mind when I wear my t-shirt, because I've had people say, talk about what? And I say, how to prevent childhood sexual abuse. And it's like, did she really just say that? But you have to say the words. So I wear my t-shirt proudly.
I haven't checked recently, but they were offering the training online for free during these times. SafePath used to hold monthly training sessions for us in Cobb. Of course, that stopped in March of 2020, and I don't believe they have resumed, but we will be sure and share that with the audience. So thank you.
And you can find it in languages other than English.
Oh, thank you, Belisa.
Yes, it is. It is an excellent training.
I want to pick up on something that Belisa introduced, the warning signs, and expand that broader, if you will, to mental health. I know I've been in the audience and in other situations, and parents and caregivers often say, how do I know when to seek help? What's the warning sign? How can I tell the difference between normal teenage grumps or whatever you want to call it, and this youth, this child really needs help? Granville, I'd like to start with you on that question. When should a caregiver really be concerned?
That's a very hard thing to answer. And I say it's hard because of where we are today. So we have emotions that are already, high. We have concerns, and you have people that are hypervigilant. So they're always waiting for the next shoe to drop. You may have situations, as we were just talking about, to where you have children that are always on the lookout because there is nothing that is safe and there are no adults that are safe. But what I will say is that as a parent, especially right now, this is probably the best time to really truthfully and honestly reestablish what that relationship is. Like just spending time. Now, granted, depending on the age, because you'll have teenagers that are like, what do you want? Why are you in my face? That's okay. That's okay. Think about the years that you've had. Kind of do a run through of what things have you noticed, because your child has and does develop a personality that you can tell. Granted, the teenage angst happens, but it's still along the same lines of who you already knew your child to be. I would just say that one of the biggest signs is noticing when there is a huge change or a drastic change. If it's one that is focused more on a mental health situation, then there are numbers of signs. What I tend to ask families are to really look at these 3 or 4 things, and I ask, what does the sleep look like? Are they sleeping more? Are they sleeping less? What is going on with eating or weight? Has there been extreme weight gain? Has there been extreme weight loss? Are they not eating at all? Are they doing more snacking? And then the last one is their interests. Did you always have a child that was interested in a certain cartoon or a certain game, and all of a sudden they just stopped? I think those, for me, were probably a really main area to look at for changes, and then start figuring out how to have those interesting conversations that are literally just about how was your day. And I say interesting because sometimes you can't say how was your day, depending on the age. Maybe it's just about modeling what you want them to do. Maybe it's about, and I think that's a huge thing for us as adults. As we get older, we start to decide what we need to shield our children from. And although that's a great thing, because there should be things that they don't know. However, part of the modeling can be helping them see, how do I talk about I'm having a hard day? And what you can do without sharing a whole bunch is just come home and be like, Julie, I know I want to ask you how school was, but could I just talk to you? My day was hard. Like I just had a really day and I just want to lay down for a little bit, but I just want to talk to somebody. Do you mind if I talk to you about it? And then you tell your daughter, Julie, I had a meeting. It didn't go too well. I fumbled on some stuff and I just felt horrible about myself. And what that does is gives you an opportunity to model to your child, oh, it's okay for me to say I had a hard day. Oh, I can tell you about the test that I failed and I was so hard on myself because I thought you would be mad. And then their kids, they'll just start talking. Once you open up that door and get them to walk in, I think that's the hugest part, is giving them an opportunity to talk.
Thank you. I'd like to ask the next panelist, whoever wants to jump in. Warning signs, when should a caregiver be really concerned?
Yeah. One thing that I always tell parents is that you're the expert on your child. You know your child best. So even if you're taking them to see a quote unquote expert, a mental health provider, you're still the expert on your child. So all of the things that Granville was saying, that you notice those little nuances and those differences, and you know that something is off. You may not be able to name it or pinpoint it, but you know that something's going on. So any opportunity to have conversations for yourself, I'm not sure what to do, or again, with your child, just keeping that door open. I always ask kids, what adult do you go to? Who can you go to? And have parents ask that same question, because it may not be the parent. It may be somebody that you wouldn't have ever thought of, but if it's a trusted adult, as long as that child has somebody that they can go to, that's always going to be a really important thing.
Be okay if it's not you.
Yeah.
Yeah, I really like how both of you phrased your answers there. And Granville, my initial thoughts are very similar to yours, where it may not be the when to intervene. We may not want to or need to wait for that breakthrough moment or that time when, we're at the very lowest with this child. That it's more about the how and the consistency, and that making sure that in your interactions with the youth, whether it's you're working in a school and you're talking with your students there, or if it's a parent situation or a family or a friend, whoever it may be, that right here, right now, we're all setting this example of breaking the stigma about mental health, but that's a huge umbrella, and making sure that we're breaking stigmas when it comes to every layer of that we aren't afraid to use words of anxiety, depression, suicide, self-harm, sexual abuse, that we're having those conversations that are factual, that are real and legit with these youth, so that they hear these terms, they know these resources, and all of you here have come to collect resources or education. And the youth may not want to come to an event like this, but a lot of them are very fortunate to have an iPhone or a smartphone or a computer within reach, whether it's a trusted adult that has that electronic or a school, and they can, maybe encourage that youth to actively seek those resources as a preventative strategy that we're talking about. You might not be feeling anxious today when you come home from school, but let's say in 6 months from now or in 6 weeks from now, you are feeling anxious. What would you do? How would we as a family unit, how would we as a team go about that? And maybe encourage them to start looking at the resources independently if they're of that age, because any way that we can include them and have it be interactive and have it be led by them is going to be far more successful than just giving a resource and telling and giving stats, because we know teens don't always want to follow every single rule that we put in place, because they're trying to explore and they're trying to learn too. So encourage them to do their own research and to find what they think might be best for them. One thing that we do at the Community Services Board that pretty much everybody does in mental health as well is we create safety plans with that teen of, if you're feeling suicidal, if you were in a dangerous situation, who are your safe adults? How do you get in contact with them? And so we prepare for that, and we make sure that those safe adults are also prepared for that. So not necessarily the when, but I just encourage all of us to think about the how are we including this conversation within their daily lives.
Thank you. And we'll hear from Beliza, but Meg, I wanted to ask you that safety plan that you talk about, I assume templates are available
Absolutely.
out there?
Yes.
Okay.
Yeah, absolutely.
Any ones come to mind immediately?
I mean, there's a variety, depends on how in depth
Depth you
or,
want to go? Okay.
want to go. If your youth is receiving mental health services currently, I encourage you to talk with their provider of whatever tools they use so that everybody is on the same page with whatever we have. Yes.
Great. Thank you.
Yeah, I just want to piggyback on two things that were mentioned that I thought that were absolutely great. First of all, be okay with if you are not the person your child is going to go to, because that is a hard thing for parents. And sometimes as parents, we have to plan an environment for our children so that they know that you're there for them, but there are other people in their environment that are, there for them. In our case, my husband and I have 2 children that are 10 years older than the other 3. So as they were growing up, we always made sure that we knew that the 2 older ones, they were going to have a different relationship with the younger ones from the ones they have among themselves because of the age difference. So we always try to create an environment in which they knew that these other 2 adults, they were going to become adults when they were very young. They were there for them, that they were a good person to speak to. That I think that our younger kids had the advantage of having those extra 2 people that have been very positive in their lives. An uncle. Just make sure that they know, he is a safe person. He loves you as much as we do. He's always going to be there for you. Create those relationship with those trusted adults that might not be family members, but having those. Then the other thing is the importance, at least in Ser Familia's case, we provide services from the optic of a family. Normally, we don't serve children in isolation. We provide, counseling or other services, but, in all cases, we try to serve everybody in the family. Because what we have found through the years is not only that you get better outcomes, but also those outcomes are going to sustain themselves. Sometimes we serve a child and we provide all of these great services, but then if we don't impact mom, dad, whoever else is in the immediate vicinity of that child, you return that child to the same family environment, and then everything goes backwards. So sometimes as providers, just trying to look at the family as a system and the different components, and how do we create a safe environment for the children, a positive environment for the children from every angle that we can tackle that.
Thank you. I'm going to ask one more question around warning signs and risk factors, and then invite our audience members, either in person or virtually. I do have some questions that were submitted ahead of time through our virtual audience members. So, but we've mentioned the S word a couple of times already, suicide, and September is Suicide Awareness Prevention Month. What should a person do if a friend, and let me use this example, what should a teen do if a friend or a peer confides in that youth that they're thinking about harming themselves or taking their lives, that they're contemplating suicide? I can't imagine a young person handling that, but I'm not naive enough to know that it's not happening. It is happening. And so could you all speak to that?
This kind of goes back to as well having those preventative conversations with your kids so that if they are ever in this situation, they know who they can go to. However, if they don't know what to do, there are so many hotlines and things like that that they can call. And most schools I know have cards and numbers. Counselors have them. The social workers have them. We try to get it out as much as we can, but letting your kids know that there is support out there to help them, and they don't have to handle something like this by themselves because it's too big for them. It's too big for one person, even an adult, to do. So just having those preventative conversations, I think, is really important.
Specifically for youth, so in the situation that Irene mentioned, that's incredibly common where obviously we know peer-to-peer interactions are happening all day, constantly, whether that's in person or online. And so the likelihood of a teen telling another teen, confiding that information with them is very high. And if you are kind of on that receiving end of that information, just know, first of all, that those feelings and those thoughts within that person, that is unique to them. And it's, again, about how we move forward with that conversation instead of saying, oh, well, you could never do that because your life is so great, or, instead of dismissing it, just allowing a space where maybe they have nobody else they can talk to about that, to process that. Let's figure out, are these just thoughts? Are we stressed? Or do we have a plan? What is happening here? Where's the severity? Getting to a place with that teen of helping them understand that if they're having these feelings, that they need to reach out to an adult, a trained professional, that start helping them figure out who is that team of people who care for this individual. Maybe teachers, and maybe anyone in their family or community. So I think that's huge, of, first of all, acknowledging that these interactions happen all the time and knowing that it is okay to have that conversation, and it's okay to invite that person to talk about these things, because without having that conversation, if we are dismissive of that or just say, well, you should seek some help, let's talk about what kind of help are you interested in? Are you interested in help? What is the level of care that you're looking for? Who do you want to talk to about this? And making a plan where we can start to include more and more people to surround that youth. That is always going to be the most successful, is to create that team helping atmosphere.
I think that piggybacking on that, first of all, never promise to keep it a secret. That's a big thing, because that friend is going to tell you, oh, I'm going to tell you this, but please don't tell anybody. Let's keep it a secret. That is a secret that you should never keep. So yes, we need to go seek help. And then asking the question. I remember growing up, people used to say, oh, you never ask about suicide, because then are you going to put, ideas in their mind? The ideas are already there. You don't need to put them in somebody's mind. And then the other myth is that, oh, if they talk about suicide, that means that they are not going to do it. No, most people that commit suicide told somebody at some point. So, ask the question, are you thinking about have you thought about harming yourself? Just name it. And then from there on, we are going to find help and follow through. Find a trusted adult that can help you with that. Don't keep it a secret. And I'm sure, many people have saved other people's life by just doing these two things, just finding, not keeping the secret, and asking the question.
Mm-hmm. Literally, I concur with everything. Right, ditto. What I will say is what I'm noticing is already a trend in kind of how we're having these discussions. So you see probably the big foundation point is making sure that you identify a network of support early on. So that includes the time where, and I think we talked about it in there, stranger danger. So if you are at that stage where you're teaching your child stranger danger, also communicate that there is other things going on with other people that may not be strangers. Also let them know who are trusted. Why can you trust them? Understanding, again, going back to the modeling, how are you having that communication to let them know this is what a trusted person looks like? This is what a trusted person sounds like. This is why I trust Julie because of X, Y, and Z. Tell me about your friend Michael. So give me a reason why you would trust Michael. That's great. But I would say all of those things is having that ability to know that I've identified the different people in my life, that if I need to say this to somebody because someone was able to say it to me, that I know that they will help me through it. And I have to also echo, do not say you're going to keep a secret. I tend to, whether it's in a counseling situation or at the school, anytime I talk to a child, I'm almost acting like I'm doing an initial consent. Understand, we can talk about whatever you want to talk about, but there are certain things that if I do hear about it, love you to all get out, but I will have to break that confidentiality. And I will tell you this, having been that person that several kids have come to with that same scenario of, I'm not supposed to say anything, so please don't say anything, but this is happening. I can tell you that majority of those times that has happened to me, they knew to come to me because I would do it. They were able to have an out. I told them not to say anything. And I said, that's fine. That is so fine. I would rather you hate me right now so that I can know that somebody else is still here. But I care about you and them that much.
Absolutely. Thank you.
Yeah, please.
We've talked a lot about talking with our kids about having their trusted people, but I want to challenge parents. Who are your trusted people? Who do you go to? Who is your network? I mean, this is what I do for a living, and I've done this for 25 years. I don't want to say that, but 25 years. And with my own children, I do not have distance from it. I'm too close to it. All of the knowledge that I have, I can't do that with my children. I have to have somebody else come to me and say, hey, have you tried this? Think about this. Step back and do this. And it makes more sense that way. So please make sure that you know who your network of trusted people are as well.
So important. Thank you. I'd like to invite anybody in the audience, if you have a question, to come on down to the mic. There's stairs on either side of the theater. And don't all jump at once, but I do want to give that opportunity. All right. Okay. Oh, thank you, Commissioner. Commissioner's going to get a few more steps in today.
Thank you, Commissioner. My name is Steve Kleinrichard, and a lot of you do know that I did lose my son 4 years ago at the age of 14 to suicide. So I just wanted to define a couple things. When you are looking for a trusted person, know that that person has to be able to react now. It's an immediate thing with the youth especially. It doesn't wait. They can't be put off. If that child is put off, they feel more lost and less hope. And the other thing I want to reiterate, which I love all the advice that was given up here, and thank you all for that. But something else to look for if a person is looking to commit suicide or complete a suicide, as we may say, another sign is everything may be crazy and different, but as soon as that changes and they're happy, it's like the eye of the storm. It's about to hit. They've made a decision. Thank you.
Thank you, Steve. Commissioner, looks like we have another question. Oh, another one? Okay.
Hey, I'm Miguel. I just had a quick question. Since nowadays technology is such a big and it's just access everywhere for kids, what would you advise for parents to shield their children from the internet, the dark web?
Yes.
Meg's
Yeah.
gonna be brave
I'm
and
gonna be
start
brave.
us off.
Yeah. That's a very expansive question. We could have, like a whole separate panel on that. Again, it comes back to that level of communication and trust within the household, within the parents, and talking with them about how they are utilizing, those electronic resources, and if we are going to be relying on them as we are, incredibly in this society, and knowing that that's just going to keep getting more and more and more extreme. So that baseline of what is safe is just going to keep moving in the future. So that is going to be a continual thing where every, couple months, maybe a couple of years, we're going to want to keep reintroducing that conversation of safety within the internet and within social media and things. For parents specifically, if they're looking at, I guess, guidelines and tools and things, go to the source, which is the internet. So Netflix has a ton of documentaries, Hulu does as well. Also there's a lot of mental health based information for youth that you can get a bunch of research about how do electronics play into mental health. And I think find out specifically, first of all, what is your youth using the internet for? What are their needs for the internet? So maybe they need it for school. They need it for certain purposes, to contact other family members or to have telehealth calls with their therapist. What are their wants when it comes to the internet? What are the boundaries that you guys are going to set within the household, and why? That is the biggest, I think, that comes into play with that is the why are we talking about this? Why are we setting this? And then when do we start looking at reevaluating those rules?
I honestly don't have anything to add to that, but I do want to say that after that has already been established, be willing to have a real honest conversation. If they do access something that you do not see as being safe or necessary or inappropriate, make sure you're having an honest conversation, because the best time for you to actually provide that insight is once that happens, and the quickest time for you to shut them out that I'm never going to tell you anything again, or I'm never going to have a conversation, is when you react in I told you shouldn't have, this and that, that's why you're grounded. Have a conversation. All right, so what made you look this up? Find out what actually sparked their interest in making those searches. What you find on there that kept you on that website? Okay, well, let's talk about those things. Okay, so we already know that was a no-no, right? Okay, so you already know there's a punishment. Okay, but let's talk about this. So make sure you have those honest conversations if it does happen, because I think that's probably the easiest way to continue doing what we said before, which is developing that connection with your child, that they will tell you different things that happens even on their own without having someone else tell it for them.
So not just the what, but the why.
Exactly.
Yeah. Okay. Lisa, did you?
Yeah, just something real quick. And the best way to be ready to have those conversations is if the rules of the family have been established. We talked about that, but many times we don't realize that as the kids grow, we can negotiate many of the family rules and the consequences, and everybody knows beforehand these are the rules and this is what is going to happen. So it's much easier when we're having that conversation. Okay, this is a rule that we had already negotiated as a family, and you knew that the consequence of breaking that rule was this.
And then following through. The
Yes.
idle
Yes.
threat. If you don't stop, we're gonna, I'm gonna pick almost a silly example. If you don't stop misbehaving, we're gonna leave the pool. And then they don't leave the pool. They stay, So the idle threat. I'm sure I did that too, though. Do we have another question,
It's
Commissioner?
a question, but kind of more of a comment. And Granville said something, but all of you have said some insightful things. My name is Tanisha Marshall, and so I've got 3 sons, and this happened literally like about a month ago. So I've got 3 sons, and the middle one that's in high school, he's our most quiet. And those are the ones we, always want to kind of probe more and ask them more questions and make sure that they are okay. And they picked a topic for an English class, and he chose suicide as the topic. And it kind of struck me. So why'd you choose suicide? Because now I'm wondering if I missed something. Is everything okay? And so when I start asking him why, like kind of like what Graham was saying, you don't have a door open so they can step through it. So I'm sort of asking him why, what's going on? Well, come to find out, a couple weeks before, in a group chat, one of the children that was all remote had sent messages to the 2 or 3 other friends in the group chat, indicating that he wanted to commit suicide. And so, my son, and I said, well, what did you do? How did you respond? He said, well, we sent him texts and we said, don't do this, don't do this. And like I think all of you said, it's, don't tell anybody. Don't tell anybody. But fortunately, they did. And so I was thankful that at least we had those conversations, not just so that they knew what to do, because I'm still then following up saying, okay, and what do you think about suicide? Now that we've had that, what is your paper about? And, and he said, no, I'm not there. That's not my thoughts. But at least he had enough, from just those small conversations of how's your day? What's going on? To know to elevate it. So, I mean, you not even have an impact on your kids, those kids can then have impact on others. And it really hit home with me. So everything you guys have said, I truly appreciate you being here. Thank you.
Thank you. Thank you for sharing that. Is there another question?
I can't see.
Hi, sorry. Hi, Ross Carmen here. Actually, I'm a high schooler right now. I just, not a question, a comment. 2 things I would say that are very important for, both parents to tell their students or kids, and for kids to know when having a friend like confide in them, hey, I'm having these thoughts, either like suicide or just like, I've been depressed. 2 very important things are, like, first of all, as incredibly frustrating as it can be, you don't have to always have a solution for them. Honestly, a lot of the time they just want to hear, hey, I'm here for you. I'm here for you. I'm here to, if you need someone to like just give you a hug, I'm here for that, man. Like you don't always need to hear, okay, we're gonna, get you on a 5-step program, but legitimately that can, because a lot of these people, as sad as it is, it's just not as simple as, hey, I got your solution right here. It's, they're depressed, and it's going to take time for that to, either not totally be fixed, just resolve itself, and during that time, they just need someone there to just, be a shoulder to cry on, not always. And again, when it gets to like actual, hey, I'm going to commit suicide, that changes things. But for just, I am been feeling very depressed, I've been feeling very down. In that time, you don't always need to have, we're going to do this, we're going to fix this, just be there for them. And that seems like a relatively simple concept, but I've noticed for, myself included, for like friends have confided in me and that stuff, it's very hard because you always feel like you're letting them down, if you don't have a solution or have, if you're not actively working to fix their problem. But that's a lot of the time not what they want, but other than that, a second thing I would say that is, I cannot undersell the importance of this, is just reaching out. It doesn't have to be a, hey, are you feeling depressed today? It can be just a, like talking in the hallway. How was the game? How'd you do on that test? Like small interactions like that on a large enough scale can really, truly feel like, make the person feel like of depression and stuff like that, just feeling like you are alone.
It's one thing we've probably all learned during the last 19 months is that as human beings, we are really wired to connect with each other, to live in tribes. And when we don't have the opportunity to have those connections, things can go off track for us. Yeah. I teach a training class called Connections Matter. It's part of our trauma-informed training. And, you learn a lot about how the human brain develops and those neural connections, and what gets fired gets wired, and that's all about human connection, and it starts at the moment of birth, truly. So did we have another question from the audience? If not, I think we have one right behind you, Commissioner.
Accessing resources, period, is not easy.
Yes.
We've been struggling and not having a lot of success. I have 2 teams.
Okay. Truly, that's our next, it's the perfect segue. So thank you for our question. We were actually truly going to pivot to resources. So who wants to tackle the subject first?
Well, I can start it. I think that definitely with the 2 school systems, one of the biggest, especially if you're in need immediately or in need at that moment, what people don't realize is when you actually need it right away is the hardest time for you to start looking, because it seems like I need it yesterday and I've called 3 people and no one has availability. So I would say, because of the school system, reach out, like the school counselor, the school social worker, support. They should have lists of stuff. It's not happening. Okay. Okay.
The need, as a result of the pandemic, the need is greater than the supply. And that is a struggle that I think all of us as clinicians are trying to figure out. We've seen so many more kids and families that need help, and there's not enough services to go around. So like he was saying, the schools are always there. That's a great starting point. They have people on staff that can help. So come ask. We're there.
Julie, didn't you have a QR code with
I
you?
do.
Okay.
Yep.
So Julie has a QR code that you can take a picture with your phone, and it's going to connect you.
Workers in Cobb County, it takes you straight to our webpage, and then it lists us all in all of our schools. And when you click on our name, it takes you right to our email.
Hopefully that will be a help. Meg?
That's a very great resource, and super accessible for everybody. That's awesome. When it comes to resources, we've all kind of mentioned it. It's about that early intervention, that prevention, that it is going to be the hardest to find that intervention in the moment that you need it. However, I think what our youth shared, I'm sorry, I don't think I caught your name, sir, but that key element of patience and knowing that when you need that immediate intervention or when you need that service, you may not get the perfect service plan or the perfect amount of resources or the best intervention right at that point in time. Unfortunately, there is that element of patience, that element of change and reevaluating and retrying. And so knowing that it can take a while to get exactly all of the bases covered. One of the things with Cobb County Community Services Board, we are a very large entity that can service youth, adults, families, and we look at a variety of facets where individuals are needing help. But still, for even if you have a whole team of providers, it can still take a while for those things. And so again, going back to the family unit of having your support system who can be there to encourage you through that process. Of course, here I'm want to commend you for being at this event, because you're in a great position to get as many resources as you can, and utilize those connections. Be persistent, be specific of what you want, what you're looking for, what you need. And of course, there's going to be a sea of resources, and sometimes it can be difficult to narrow down and find the exact fit. But I appreciate you coming out and being here. And that is every one of those interactions that you do, whether it's at a community-based thing like this, whether it's online that you're just searching or talking with a friend, every single time that you keep having that conversation and keep looking, you're going to get closer to the answer.
So it sounds like the very first thing, if you have a child involved in a school system, is to contact counselor or social worker. And you may not be the resource, but you will be able to connect them with resource. Cobb County CSB is another resource. We had Cumberland Counseling Centers here this evening. They are a resource. And I know we have issues of access in terms of insurance. And Belize going to talk, I think, right after Granville. And so we have the the lower numbers of Latino. Together we will overcome. Okay, Granville, you wanted to jump in back in on that?
Yeah, I just wanted to say another number or website is the Behavioral Health Link. If you call them, they will help with identifying if you do have insurance. They can look things up and they'll give you different numbers. Sometimes they'll even help by calling to find out if people are available. So the Behavioral Health Link of Georgia is another access number.
I will also offer that sometimes your faith community can provide you with resources, and it may not necessarily be Christian-based or faith-based, but oftentimes people turn to a faith community in times of crisis, not just physical needs like food and shelter and utilities, but oftentimes behavioral health support. And so if you're connected with a faith community, that could also be a referral resource for you. And Belisa?
Yeah, your child's doctor, your child's pediatrician. It is certainly a resource for you because he or she might be able to connect you and then can follow up with you. There's also many nonprofits in the community, NAMI, the National Alliance for Mental Illness. There are many as smaller entities that people don't know about. But usually what happens is that one of us is going to connect, since we are somehow interconnected, one of us is going to connect to one another. We might not be able to provide the service, but we are then going to connect with, have you already talked to your school? Have you already, we're going to provide other resources. And then sometimes when I have a child with a very particularly complicated disability. When he was little, finding resources for him took us to move 1,000 miles away from where we lived and took us to knock into many doors until we found. So I understand that frustration when you don't get the answers and you feel like days are just going by and you don't get that answer. But, we kept knocking on doors. If this door didn't have the answer, we went to the next and we went to the next until we found what we needed for him.
I'd like to ask the panel a question, and not everybody has to answer, but one that came in from a virtual participant. How can we, schools, parents, caregivers, better serve students and youth on the autism spectrum that might have higher levels of anxiety anyway, that, of course, has just been built over the last 18 months? I inferred that the child had not been in school at all during the last school year, but as they integrate back into daily school life. So anybody want to talk about specifically for children on the spectrum?
What I can say is that the school systems are definitely set up for children on the spectrum and creating IEPs so that they get services that they need. It was interesting to see how those services came about in the virtual world, but they are there. And it really is individual on the child and where they are on the spectrum in what they are needing. So I would definitely start there with your school. If your child is not already connected, then talk with the teacher to see what you can do to be connected.
Just kind of similarly to that, when it comes to working with an individual who is on the spectrum or any type of special needs in general, just remembering to, even though we kind of see it as like a framework of trying to help that individual, we're going to help you, but making sure that they are in, that driver's seat of where we're going with these services, that they have autonomy, that they are able to fully understand exactly what is happening to the best of their interests and abilities. And so that way, it's always circling back to that independence and trying to pursue a plan or a service intervention or whatever it may be that that individual is comfortable with and that is receptive to the needs of that individual. I myself personally, I have a younger sister with special needs, and her care, we've seen that develop over the years. She recently turned 18, and so now we're in a whole nother ball game there. And we've really seen so much improvement with providers who really go back to that autonomy of the individual. And I'm not here to necessarily just give you a resource and provide a service, but to really bring that individual into what's happening.
Thank you. Boy, our time has just flown by. I'm going to ask one last question. If we could just sort of whip through the panel as quickly as we can. More about, and I have so enjoyed hearing the noises or from the baseball or softball game, whatever is going on, because I think that's one way of self-care or building resilience, right? Being part of a team, being together. It's been great to hear them. But if you had some advice or wanted to impart some wisdom to our youth and to our caregivers on either pick a self-care or how to build resilience, going to ask you to invite that or to share that, and we will start with Granville.
Okay. So one thing that I was doing several trainings on for teachers and parents was 4 things. Just think of 4 things that you can do. If you can incorporate it daily, then it will decrease anxiety symptoms, depression symptoms, and kind of help overall with your self-care. One is maintain an actual consistent schedule. So have a routine. So when we did have that lockdown, actually wake up like you were going to school, actually eat lunch when you would have eaten lunch, have a routine. The second one is socialize, whether that is letting your child pick up the phone and actually call somebody, whether it's FaceTime or on the phone that they haven't spoke to in a while. Give them that time to connect, because we still need to connect. If anyone had a situation while we were in lockdown and you try to take away the phone, did anybody's child completely melt down? That might have been why, because it felt like all of my connections were gone and this is my last one. So socializing. The third one is a passion project. And that passion project can be anything that you like to do as a hobby, or maybe as an adult, it's, hey, I've always wanted to do this certain business. Spend 5 minutes, research something, look at a website that drives that passion for you. And the last thing is some kind of physical activity. Whether that physical activity, based on what your capabilities are, is just you standing outside, walking to the end of the driveway. If you're like some family members of mine that aren't able to walk, then just being out in the sun for a couple minutes. But if you can make sure that that's something that you at least focus on, and it's not about being a task, it could be literally you intentionally doing it for 5 or 10 minutes, each of those things. If it's reading a book that you love to do and you haven't found time, tell yourself, I'll read 2 pages. But those 4 things: socialization, creating a routine, physical activity, and passion project.
At the beginning of last school year, since the school year started a little bit later, and I'm not going to remember the name of the website, but if you look up, just go to Google, and it's the 21-day self-care challenge, and it should pull up the website that it's from, and it gives a calendar of something to do every day. And it's very simple things. Stand up and walk away from your computer. Drink 3 glasses of water. So it's not like overwhelming things, but if you can't really think of things to do, this just lays it right out there for you and just sort of pick one. Another thing about self-care is that it doesn't always look like bubble baths and spa days. I would like to say that I could go to the spa every day, and that does not happen. But doing something, just checking something off a list that's been weighing heavy off of you, like, oh, I need to call my bank about this, and you've been putting it off, do it. And then it wasn't as bad as what I thought it was. So sometimes it's just getting things done that you've been putting off is a good way to have self-care.
Yeah, I think that the concept that self-care is always going to be enjoyable is not always true. Sometimes self-care is going to a therapist and crying for 40 minutes. Sometimes your self-care is a bubble bath where you're listening to great music and you're having a good time. And sometimes it's taking a walk. Sometimes it's 20 seconds away from your computer. So it's so versatile. And I think when it comes to practicing that self-care, first of all, being mindful of what are the moments in your life where you feel really relaxed, where you feel very joyful, what just happened to get you to that point, and kind of hone in on what those common themes are. And being mindful of what are your needs when it comes to self-care. We're going to have short-term self-care needs where I am very stressed after this work meeting and I'm going to go outside for just a couple minutes, and that's going to be like a mini self-care. And sometimes we have self-care that's more based on longevity of eating, a certain way or exercising a certain way or going to a therapist or these type of things. So start noticing in your life, where are these like little pieces of self-care that just kind of give you a boost throughout the day? But what are these bigger pieces of self-care that will impact you for a longer period of time?
Sometimes self-care could be caring intentionally for others. Something that happened to us as an organization during the pandemic was that we never stopped providing services in person. So at some point, I remember driving on 285 and I was the only car there. It was, some days it was eerie, very isolating because everybody was in lockdown and we were at the office. So I guess that's something that helped us a lot in our self-care as an organization, as people in the organization. We were very intentional in doing things, to care for one another and make sure that we were all okay. But something that somebody shared at one of our staff meetings was, how important it was, the sense of purpose that we got when we started caring for people in ways that we have never done before. We went into mobile home parks to give out diapers. And intentional, we did it as teams. Okay, you guys are going to do diapers here. You guys are going to do grocery orders there. And it felt so, you felt a sense of purpose. And even though you were not caring for yourself, that made us like a boost of energy, of feeling good about, yes, we are moving forward. Things are very isolating and difficult now, but, it renewed your sense of and faith in humanity as well.
Back to that connections. Yeah. Well, for those of you who joined us in person tonight, will you join me in giving a big round of applause and a thanks to our panelists? And I'd like to invite the commissioner, and here she is, to close us out. So thank you so much. Thank you, everyone, and thank you for your very insightful conversation. My remarks will be very brief here because we are definitely over our time, but I just want to extend a hearty thank you. Louisa Wakeman, I appreciate you making these things come to reality. Irene Barton with the Cobb Collaborative and bringing this idea to us and kicking off this series. Aaliyah Korju, my assistant, who I could not make it without her. Sarah, Julia, Ross, and Sam, also interns in my office. The Cobb Communications team for sticking with us throughout this period and also staying longer. Cobb Parks, Public Safety, my fellow board members, library staff, all of our vendors who participated in the fair, our panelists. With regards to my fellow board members, there is a proclamation that I would like to present. So you can see all of our board members did sign, and I'll read briefly. September 10th is World Suicide Prevention Day, and September is National Suicide Prevention and Awareness Month, when millions of people around the world join their voices to share a message of hope and healing. And in these challenging times, messages of hope and healing are needed more than ever. Each death by suicide directly impacts numerous family members, friends, loved ones, and by extension, the entire community. And Cobb County residents should be able to access high-quality prevention, support, rehabilitation, and treatment services that lead to mental health, stability, recovery, and a healthy lifestyle. Everyday people enter treatment into behavioral health services and community supports and begin the road to wellness and recovery. And resiliency begins early in life within families and communities and can be strengthened and reinforced throughout the lifespan. It is essential that we educate residents about suicide, mental health, and substance abuse problems and the ways they affect all people in our community. We encourage relatives, coworkers, friends, and providers to recognize the signs of mental health issues and guide those in need to appropriate services and supports. We, the Board of Commissioners, proclaim the month of September 2021 as National Suicide Prevention and Awareness Month and encourage all people to have hope and seek appropriate help. And as we all go through isolation, we're experiencing something. I draw back to an experience that I had last year. We do weekly huddles every 2 weeks with the community. And someone on the huddle shared with our team that they were feeling really depressed. And they went to go see family. And they realized that in all of the isolation, they had forgotten who they were. And being around people and being in our huddles reminded them of who they were. And I want that to really sit with you because that was a lesson that really encouraged me. And it was also something that I was contemplating suicide that was close to me. It was to remind them of who they were by getting them around people that they could interact with. So with that, I will say thank you. Have a good evening. I appreciate you all sticking with us. Good night.